Most people believe there's nothing you can do in the first few minutes of a stroke except wait for an ambulance. That belief is killing brain cells right now in someone you might know. What I'm about to show you challenges everything you've been told about those critical first moments. I'm Dr. Megan Foster. 24 years in cardiac surgery taught me this. What happens in those first minutes isn't just important. It's the difference between someone regaining independence and someone losing it permanently. Here's what most people don't realize. Right now, while I'm speaking to you, someone is having a stroke. In the next 90 seconds, their brain will lose approximately 1.9 million neurons. That's not a metaphor, that's physiology. But here's what changes everything. Not all of that damage is inevitable. Some of those neurons are in what we call the penumbra, the zone around the core damage. What happens in the first minutes you're with that person determines whether those cells survive or die. Most doctors won't tell you this in a standard office visit because there's no time. You'll get a pamphlet about face drooping and slurred speech, then sent home. That's not enough. What you're about to learn goes deeper than any pamphlet, deeper than standard medical advice, because this is about protecting brain tissue before the ambulance even arrives. Before we go further, let me mention something. After 2 decades treating patients with excellent lab numbers, normal blood pressure, people who did everything right on paper, I kept seeing the same pattern. Their bodies were aging faster than expected. Emergencies like stroke hit without warning. That's why I created the Longevity Foundation Guide. It's a clear explanation of what actually drives aging, circulation decline, inflammation, and recovery capacity after 55, and how to reverse it. If you want to understand the foundation rather than just reacting to emergencies, it's linked in the description. Now, let's get back to the topic. Here's the curiosity lock I need you to hold. Most stroke damage doesn't happen because of the blockage itself. It happens because of what the body does in response. And there's one thing family members do with the best intentions that accidentally accelerates brain damage. I'll explain exactly what that is and why, but first you need to understand how stroke damage actually unfolds. Let me give you the foundation. A stroke isn't a blocked vessel sitting there doing nothing. It's a rapidly evolving blood flow emergency inside the brain. Think of it like a fire. There's a core area that's severely damaged, yes, but surrounding that core is the ischemic penumbra. Brain cells that are injured but not dead, starving for oxygen, on the edge. What you do in the first 5 to 10 minutes influences whether those cells cross into permanent damage or whether they can be saved. That's not hopeful thinking. That's neuroscience. It's why the actions you take before the ambulance arrives aren't just comforting gestures. They are physiologically meaningful. If this information is already shifting how you think about stroke response, if you're realizing there's more you can do than you thought, take a moment and subscribe. Over 94% of people watching aren't subscribed, which means they'll miss videos like this when they need them most. And if you've witnessed a stroke or if someone you love is at risk, leave a comment. It helps this reach the people who need it. Let's get into what you need to recognize first. You've probably heard of FAST: face drooping, arm weakness, speech difficulty, time to call emergency services. That's good, but incomplete. The earliest signs of stroke are often quieter. These are the signs people dismiss, the signs people wait on. Waiting is what costs brain cells. Here's what to watch for: sudden confusion. Not gradual, not over days. Sudden. The person is speaking normally one moment, the next they can't find words or they're using the wrong words entirely. Difficulty understanding simple instructions. You ask them to raise their hand and they look at you like you're speaking another language. Strange heaviness or numbness on one side of the body. They might describe it as their arm or leg feeling dead or disconnected. Visual disturbance in one eye. Half their vision just went dark or blurry. Sudden dizziness or imbalance. They stand up and immediately lose their footing, not because they tripped, because their brain's coordination center just stopped working. And here's the most important one: a feeling that something is off. No dramatic symptoms, no pain, just a sense that something changed suddenly. Many stroke survivors report this. They felt something shift inside them. They couldn't name it, but they knew. Listen carefully. A stroke does not require a headache. It does not require chest pain. It can happen silently, which is why you believe the symptom when it appears, even if it seems minor, even if the person says they're fine, even if you're not sure. Here's what you do the moment you suspect stroke: call emergency services immediately, not in 5 minutes, not after you see if it passes, immediately. Do not drive the person yourself. Do not wait to see if symptoms improve. Time is brain. Every minute without treatment, the brain loses approximately 1.9 million neurons. You call, you get professionals coming, and then while help is on the way, you do what I'm about to teach you. This is where most people make a critical mistake. The thing I promised to explain: family members see someone having a stroke, and their instinct is to help the person stand up, walk them to a chair, keep them moving. It feels helpful. It feels like you're doing something. But here's the problem: movement increases the brain's demand for oxygen. During a stroke, oxygen supply is already compromised. By encouraging movement, you're forcing the brain to work harder at the exact moment it's starving for blood flow. So here's what you do instead. If the person is conscious, position them in a way that supports cerebral blood flow without increasing demand. Sit them down or lay them down with their upper body slightly elevated, about 30 degrees, not completely flat, not sitting straight up, 30 degrees. Prop them against a wall or a couch. Keep their head and neck in a neutral position, not twisted, not flexed forward, neutral. And loosen any tight clothing around the neck. Tight collars, scarves, necklaces, anything that could restrict blood flow. This position does something important. It optimizes the pressure gradient that allows blood to reach the brain. Completely flat risks increasing intracranial pressure. Sitting straight up risks reducing perfusion pressure. 30 degrees is the sweet spot. If the person is nauseated or drooling, make one adjustment. Turn their head gently to the side. This prevents aspiration, prevents them from choking on their own saliva or vomit. But you do not lay them completely flat unless emergency professionals tell you to. You maintain that 30-degree elevation and turn the head. Positioning handled. Now let's talk about something most people never think about: breathing. When someone is experiencing a stroke or when a family member is witnessing it, panic is automatic. And panic does something to breathing. It makes it fast and shallow. Rapid, shallow breathing reduces the efficiency of oxygen delivery to the blood. You're taking in air but not extracting oxygen effectively. During a stroke, inefficient oxygen delivery is the last thing you need. Here's the technique. If the person is conscious and able to follow instructions, guide them through controlled breathing. Inhale slowly through the nose for 4 seconds. Exhale gently through the mouth for 6 seconds. Repeat. If they can't follow instructions, you do the breathing out loud. You model it. Breathe slowly and audibly next to them. Often people will unconsciously match the breathing pattern of someone near them. Why does this matter? 3 reasons. First, slow breathing improves oxygen extraction and delivery to the blood. Second, it helps prevent blood pressure spikes caused by panic, which can worsen brain bleeding in certain types of stroke. Third, it supports cerebral circulation by maintaining steady carbon dioxide levels in the blood, which influences blood vessel dilation in the brain. You are not treating the stroke. You cannot fix the blockage, but you are stabilizing the environment around the brain. You're giving those penumbral cells, those cells on the edge of survival, the best possible chance to hold on until medical treatment arrives. Now, let me tell you what not to do, because these mistakes happen constantly and they matter. Do not give the person food, drink, or pills. Their swallowing reflex may be impaired even if they seem alert. Aspiration pneumonia, which happens when food or liquid enters the lungs, is a serious complication after stroke. Do not give aspirin unless emergency services specifically tell you to. Some strokes are caused by bleeding, not clots, and aspirin makes bleeding worse. You don't know which type of stroke this is. Neither do I. Only imaging at the hospital can tell. Do not force the person to move or repeatedly test their strength. I know it's tempting. You want to see if they can lift their arm, if they can stand, if symptoms are improving. But forced movement increases oxygen demand and can destabilize someone who's already compromised. And do not let the person walk it off. This is not a muscle cramp. This is a neurological emergency. Walking it off is not an option. These rules exist for a reason. They're not based on caution, they're based on physiology and decades of emergency medicine evidence. Following them protects the person, ignoring them increases risk. Here's something that becomes even more critical as we age. After 60, blood vessels lose flexibility. They become stiffer, less responsive. Recovery reserves shrink. The body's ability to compensate for injury declines. That's why early circulation support, controlled breathing, proper positioning matter even more in older adults. A younger person's brain might tolerate a delay. An older person's brain often cannot. This connects directly to something I explain in detail in the Longevity Foundation Guide. How circulation, inflammation, and recovery capacity quietly shape outcomes long before emergencies ever happen. You can address stroke risk months and years before a stroke occurs by understanding what drives vascular aging. But that's a longer conversation. Right now, we're focused on crisis response. Let me give you a scenario so this becomes concrete. You're with someone, maybe a parent, maybe a friend, and they suddenly stop mid sentence. They look confused. They try to speak, but the words come out wrong. You ask if they're okay, and they don't answer clearly. What do you do? First, you recognize this could be a stroke. You don't wait to be sure. You act, call emergency services immediately. Tell them you suspect a stroke, give them the location. Then, while the call is happening or immediately after, guide the person to sit down. Position them at about 30 degrees, upper body slightly elevated. Keep their head and neck straight. Loosen anything tight around their neck. If they're panicking, start breathing slowly and audibly. Inhale for 4, exhale for 6. Stay calm. Model calm. If they can follow instructions, guide them to breathe with you. If they can't, keep doing it anyway. Your calm becomes their calm. You do not give them water. You do not give them medication. You do not ask them to stand or walk. You stay with them, keep them positioned correctly, keep breathing controlled, and wait for professionals to arrive. That's the protocol. Simple, evidence based, and it works. Now, here's something most people don't think about. What happens emotionally during a stroke matters almost as much as what happens physically. I've worked with enough patients and families to know that the emotional response, the fear, the panic, the helplessness affects decision making. Poor decisions made out of panic worsen outcomes. Let me reframe this. When you witness a stroke, you are not helpless. You have a role. Your role isn't to fix the stroke, it's to protect the brain while waiting for people who can. You do that through positioning, through breathing, through staying calm. That is not a small thing. That is a meaningful contribution to someone's survival and recovery. Knowledge removes fear. Fear clouds judgment. Clear judgment protects brain cells. This is why I'm spending 17 minutes walking you through this. The information you're learning right now could be the difference between someone you love regaining independence or losing it. Let me also address something important. Some of you watching might be thinking, what if I do all of this and it doesn't help? What if the person still has severe damage? That's a fair question. Here's the answer. Stroke outcomes depend on many factors: the size of the blockage, the location in the brain, how quickly medical treatment begins. Some of those factors are beyond anyone's control. But the actions I've taught you, positioning, breathing, calm response, those are within your control. And even if the outcome isn't perfect, even if there is lasting damage, you will know you did everything you could in those first minutes to give that person the best possible chance. That knowledge matters. It matters for you and it matters for them. Now, I want to take a moment and talk about prevention because while this video focuses on crisis response, the bigger conversation is how do we reduce the likelihood of a stroke happening in the first place? That's where most medical conversations fall short. You get told to lower your cholesterol, manage your blood pressure, maybe take a statin. Those things help, yes, but they're downstream interventions. What's upstream? What drives vascular aging, inflammation, and endothelial dysfunction that leads to stroke risk? That's the foundation. It's exactly what I address in the Longevity Foundation Guide. Not quick fixes, not supplement lists. A clear explanation of how your vascular system ages, why it becomes vulnerable, and what you can do to support it long before emergencies occur. If you're interested in understanding the biology rather than just reacting to symptoms, check the description. Back to the immediate topic. Let's talk about recovery expectations because this is something people often misunderstand. If someone receives treatment quickly, if they get to the hospital within the critical window, if they receive clot busting medication or mechanical thrombectomy, the outcomes can be remarkably good. I've seen patients walk out of the hospital with minimal deficits who just days earlier couldn't move one side of their body. But that's only possible when time is respected. When someone recognizes the signs early, when they call immediately, when they don't waste minutes hoping it will pass. The window for clot busting drugs is typically 3 to 4.5 hours from symptom onset. The window for mechanical clot removal can extend longer in certain cases, but the earlier treatment begins, the better the outcome. Every minute counts, literally. When you position someone correctly, when you support their breathing, when you keep them calm and stable, you're buying time. You're preserving that treatment window. You're giving the medical team the best possible conditions to work with when they arrive. Here's another scenario I want you to think through. What if you're alone when stroke symptoms start? What if there's no one else around to help you? This is critical, especially for people who live alone or spend significant time by themselves. If you experience sudden confusion, sudden weakness, sudden vision changes, anything that feels like a neurological shift, your first action is the same. Call emergency services. Do not try to assess how bad it is. Do not try to figure out if it's serious enough. Call. If you can, unlock your front door so paramedics can get in. Then sit or lie down in a safe position. 30 degrees elevated if you can manage it. Stay as calm as possible. Breathe slowly. Do not try to walk around. Do not try to drive yourself. Wait. Help is coming. And if you're someone at higher risk for stroke, if you have high blood pressure, atrial fibrillation, diabetes, a history of TIA, transient ischemic attack, consider keeping a list of your medications and medical conditions near your phone or on your refrigerator. Paramedics look for that information. It helps them make faster, better decisions. Now, let's talk about something that often gets overlooked: the recovery period after a stroke. Even with excellent acute treatment, recovery takes time: weeks, months, sometimes longer. And the quality of that recovery depends heavily on rehabilitation. Physical therapy to regain movement, occupational therapy to relearn daily tasks, speech therapy if language was affected. But here's what most people don't realize: the body's capacity to recover, its neuroplasticity, its ability to rebuild neural pathways, that capacity is influenced by the same factors that influence aging: inflammation, vascular health, metabolic function. If those foundations are weak, recovery is slower and less complete. If those foundations are strong, recovery is faster and more thorough. This is why I keep coming back to the importance of understanding the biology. You can't control whether a stroke happens, but you can influence how well your body responds to it and recovers from it by addressing the upstream factors months and years in advance. Let me bring this full circle. We started with a belief. Most people believe there's nothing you can do in the first few minutes of a stroke except wait. Now you know that's not true. You can recognize early signs that others miss. You can position the person to support brain circulation. You can guide controlled breathing to optimize oxygen delivery. You can stay calm, which helps them stay calm. And you can avoid common mistakes that accidentally worsen outcomes. None of this replaces medical treatment, but all of this supports it. You're not stopping a stroke at home. You're protecting the brain while help is on the way. And in those critical minutes, that protection makes a real measurable difference. If this video changed how you think about stroke response, if you now feel more prepared than you did 17 minutes ago, I want you to do two things. First, subscribe. Around 95% of the viewers aren't subscribed, which means they miss videos like this when they need them most. Second, share this. Send it to someone who might need it: a parent, a friend, a colleague, someone over 60, someone with risk factors, someone who lives alone. I'll see you in the next video. Stay informed, stay prepared, and take care of the people you love.